I certainly think that staff are our most important asset. And without our staff, we couldn't achieve anything. We couldn't achieve the delivery of our strategy. We couldn't get to where we want to be in world-class commissioning. So really, our staff mean a lot to us. Part of what our team do is to try and encourage staff to come forward and get involved with lots of things that they wouldn't normally get involved with. Actually asking them what sort of organisation they would like to be part of. Now, one of the big things that did come back to tell us was we would love to be part of an organisation where we felt supported to grow and to be developed to realise our full potential.
I work within the public health department and I commission a range of services for mental health in primary care. I've commissioned the Time to Change campaign, which is an anti-stigma campaign which is trying to reduce the stigma around mental health, and this has gone Tees wide, so it involves the other 4 PCT areas. And what we're really trying to do is just to tackle stigma and help people to access help easily and earlier within their life. Through our communicating intentions, we involve the public and the patients in consulting to see what is it that they want. Once we get to know what exactly they need and what are the health needs within the population, we combine the two to actually provide a service which is actually needed and which is value for money. I think people are beginning to realize now that 1 in 4 people do suffer from mental health problems, and it's more common than we think. So with this initiative, I think it's getting into the public eye, and latching on to the National Time to Change campaign, we're bringing it closer to the people just to underline how common mental health problems are and to eradicate the stigma around it.
My role as a health improvement specialist is commissioning preventative and treatment services for children and adult obesity. In Stockton, we have high childhood obesity rates, one of the highest in the country. So an example of the work that I do is that we contract a number of providers, including Tees Active, which is our local leisure centre provider, dietetics, Alliance Psychology. So we contract them to deliver our Young Persons Active Health Scheme, which is a treatment services for children who are overweight and obese, and they work together to provide a service which is evidence-based. My role is to performance monitor them to ensure that they deliver the outcomes that they're commissioned to deliver on. How we ensure that families have accessibility and it's a convenient service is that the 3 providers work well together to deliver MDT assessments and ensure that that family goes through the right pathway that's convenient, accessible, and it's tailored to their needs.